Hi everyone, it's Wednesday, time for a little Wisdom Wednesday. Thought I would spend a little time today talking about supplements and the types of things that we like to recommend. And for most of you who are patients here know that we recommend supplements in a pack that we can put together for you through our nutraceutical company called the MedPacks. These are really nice because they're, well, back in the day when we used to travel or we're taking something to work, rather than having lots of bottles to open and to put in our pill packs, we just had the pill packs already set up and shipped to you with your name on them, and we could put anything in there. But one of the things that we put in our basic pack for everyone is an omega-3 fish oil in the morning and one in the evening for many people who are at higher risk for cardiovascular or cerebrovascular issues. But I thought I'd talk a little bit about omega-3 and what it is. It's an essential fatty acid. We have fatty acids that we can make, but we have some that are absolutely essential, meaning we have to get them in the diet. And the omega-3s, particularly the DHA and the EPA, are essential fatty acids that we get from fish and organic meats. And then the one that is plant-based, called alpha-linoleic acid, is a plant-based omega-3, not quite as potent and not as readily usable in the human body for the purposes that we look at in terms of what it can do for us, these omega-3s. So EPA and DHA are the main ones, and EPA more so for heart and DHA for brain. But without really needing to go through breakdown, I just thought I'd mention these. So these are fatty acids that are important for overall health, but do a lot of things in the body, and I wanted to walk through those. But before I do, I thought we would just visit real quickly the different types. So there's three forms of omega-3 that we get. There's the triglyceride form that we can achieve and obtain from microalgae, and then just our regular omega-3 fish oil from fatty fish, which is an ethyl ester form. And then the phospholipid form is from krill. Lots of discussions and opinions about what's better, what's not. I don't really have a real preference on that. I just think you need to make sure that you get some DHA and EPA in whatever form you tolerate. I know a lot of folks don't like omega-3 fish oil because they burp it up. I tell a lot of patients just stick those in the freezer and take them frozen, and you may find that it's not as big a problem for you. But taking at least 1 or 2 a day, and for people really at high risk for cardiovascular disease, taking up to 4 a day. Some of the studies that are being done out there are really high dosings of omega-3, and the benefits seem to be quite great overall. So let's kind of walk through the overall benefits. We know that omega-3 is great for heart health. It can lower LDL and raise HDL. It can lower triglycerides. It can prevent events. It may help prevent plaque formation. It may also decrease the incidence of fatal arrhythmias. So for heart health, it's exceedingly beneficial. We know that brain health is quite helped with omega-3s. We know that probably 45 to 50% of the brain is polyunsaturated fatty acids. So we know that it's important for transmission of neural information, the progression of transmitting neural information from one neuron to the next, propagating signals, helping with overall brain health and conductivity within the brain. So quite impressive group of symptoms that are improved in the brain, particularly with omega-3. It can seem to be helpful in weight loss. There have been quite a few studies done, and in some of those studies, people who are taking omega-3, it helps with weight loss, in addition, obviously, to a good program. And of course, here in our practice, we are very big on fasting and time-restricted eating. It may decrease liver fat. We know that non-alcoholic fatty liver is one of the biggest risk factors for liver transplant, and we're seeing that more and more. And so anything we can do to help diminish that risk is very beneficial. So omega-3s help with that. It helps with a lot of mental issues, depression, attention deficit disorder. These can be improved with this. Cognitive decline as we age having more and more fish oil can be of benefit because it helps with blood flow as well as neural transmission. For asthmatics, it may decrease the risk for asthma attacks and may lessen allergy symptoms. It's good for bone health, and we don't know exactly how it works, but people who take more fish oil have healthier bones. It decreases your risk for age-related macular degeneration, so it's great for eyes and good for vision. It reduces inflammation, so therefore it can improve joint pain and stiffness, particularly in people with arthritis. We know that it's beneficial for the skin and has been shown to be exceedingly beneficial for early life and during pregnancy. So we see a lot of areas where omega-3 is quite beneficial, and I hope that even for those of you who struggle with taking omega-3 will find that through understanding and more knowledge of what it can actually do in the human body, you might be more inclined to take it. Now, we do know that eating a fatty fish 2 times a week can also help you get the amount of omega-3s, but typically the American diet just does not have a lot of omega-3. So I encourage you to continue to take your supplements, in particular if you have either a strong family history or have some issues with cardiac or brain function concerns, strong family history of Alzheimer's. These are areas where you might want to be sure to perhaps take an extra 1 or 2 here and there. So I do take 2 a day, and do have a strong family history of heart disease. Probably as I age, I may increase that, but that's where I am today. And I hope that this has been helpful, and we'll continue to talk about more supplements in the weeks ahead. You all have a great week, and we'll talk again soon.